How to differentiate schizotypal traits from early schizophrenia in teens. Have you ever wondered how to tell apart schizotypal traits from early signs of schizophrenia in teenagers? This is an important question, especially for parents and educators. Understanding these differences can help in getting the right support for adolescents who may be struggling. First, let's talk about schizotypal traits. Teens with these traits often display odd or eccentric behaviors. They might have unusual beliefs, like magical thinking or superstitions. Social anxiety is common, making it hard for them to form close relationships. These teens may seem socially isolated and have flat or inappropriate emotional responses. They might also experience mild perceptual disturbances. For example, they may feel like someone is present when no one is there. However, they do not usually have persistent hallucinations or delusions. Importantly, teens with schizotypal traits often have some awareness that their thoughts are unusual. They can be persuaded that their beliefs might be distorted. Now let's shift to early schizophrenia. This condition involves more serious symptoms. Adolescents with early schizophrenia often experience persistent hallucinations and delusions. Their thinking can become disorganized, which makes it hard for them to distinguish between what is real and what is not. These symptoms are more intense and longer-lasting compared to schizotypal traits. One key difference is insight. Teens with schizotypal traits usually understand that their beliefs are odd. In contrast, those with early schizophrenia often lack this insight. They may strongly believe in their delusions, even when faced with evidence that contradicts them. Another important point is the impact on daily life. Early schizophrenia tends to cause significant impairment in social, academic, and everyday functioning. Teens may withdraw from activities they once enjoyed, see a decline in school performance, and experience increased social isolation. This level of dysfunction is typically more severe than what is seen with schizotypal traits. When it comes to duration and intensity, the psychotic symptoms in schizophrenia are more continuous and intense. Schizotypal traits, on the other hand, are more stable personality features that may include occasional brief psychotic episodes. Social behavior also differs. While both groups may show social anxiety and isolation, teens with schizotypal traits often exhibit eccentric speech and behavior. In contrast, those with early schizophrenia may display more disorganized or incoherent speech. From a clinical perspective, it is essential to monitor how symptoms progress over time. Early schizophrenia often shows a decline in functioning and the emergence of clear psychotic symptoms. In contrast, schizotypal traits ranges more stable with less severe reality distortion. Early intervention is key. Schizophrenia may require more intensive psychiatric care and possibly medication, while schizotypal traits may benefit from psychotherapy focused on social skills and cognitive restructuring. In summary, differentiating between schizotypal traits and early schizophrenia in teens involves looking at the severity and persistence of symptoms, the level of insight, and how much daily life is affected. Understanding these differences can lead to better support and treatment for adolescents facing these challenges.